AgTegra is a farmer-owned grain, agronomy, and energy cooperative with a large presence in South Dakota and southern North Dakota. Their technical rescue team employs about 30 high-angle technical rescuers to assist in grain bin rescue situations. They have agreements with numerous South Dakota counties to be an additional resource for high-angle rescues. The technical rescue team holds quarterly training drills.
Today we're doing patient packaging on top of the elevator here. The scenario is someone had a heart attack up there. We need a means to get them down on the ground fast, the healthcare, so we're going to go up there and package them in a backboard and a sked and lower them down with a rescuer. Our other two scenarios are confined space. Somebody who's climbed on the ladder, fell and broke their leg, and they're laying down there and they're 20 feet underground. We need to get them out. So we use high-angle rope rescue and rescuers to extract them from the hole.
This drill included 7 frontier and rural medicine students who observed and participated in the training.
I think that this is an aspect of medicine that we don't usually get to see. We're usually on the receiving end in emergency departments and hospitals, so we don't get to see what first responders usually do on the scenes. And so I think it's a really good perspective for us to see how they do what they do and also to know what to expect when our patients come in.
Fellow medical student Brenda Orozco, who is currently training in Parkston, South Dakota, agrees.
I thought it was really interesting. I personally did not grow up on a farm, so just being here and seeing what the actual environment is like was really helpful. I am training in a rural town too, so I feel like that's given me a lot of new perspective that I wouldn't have had otherwise in a bigger city like Sioux Falls or Rapid.
On this training day, the team also practiced underground pit rescues. The patient is tied to a backboard, then lifted to safety through a pulley system.
It's important because there's not anyone else besides Aberdeen City that does this, and Aberdeen City can't respond in our area to all these calls. So it is a specialized training. We take a lot of pride in doing it, and it protects both our customers and ourselves from these events.
Because of AgTegra's large footprint in rural eastern South Dakota, Dr. Matt Owens, in collaboration with Redfield Community Memorial Hospital and the USD Sanford School of Medicine, implemented Dakota Responders, another emergency care program. AgTegra pays employees to get trained in 3 areas of emergency care: stop the bleed, the use of Narcan for opioid overdose, and the use of automatic external defibrillators, or AEDs.
We were able to pre-position a significant amount of what we call ditch kits. It's got stuff to stop the bleed, hopefully prevent you from bleeding to death, because AgTegra has probably 100, 150 vehicles on the road at any given time during their busy season. So the idea is these folks will respond to a car wreck or whatever trauma and provide some life-saving intervention until EMS can arrive.
Since the beginning of the year, about 100 employees have become Dakota Responders, with some going on to become EMTs. The hope is that they'll ease the rural EMT shortage throughout the state.
And our numbers are way beyond I thought what we'd ever see as far as EMS, EMT, EMR, and Dakota Responder.